All right, I think we are live.
Wonderful.
Yeah, I think we're live. So welcome everyone. Welcome. I'm Dr. Renee Volney-Darko, and I'm board certified OBGYN and your go-to pre-med mentor, strategist, and coach. And I have a special guest today. My guest today is Miss Todd Young, and she is the pre-medical board member of the Student National Medical Association. So, welcome.
Thank you so much for having me.
Yeah, I'm so excited to have you on here today because I think the students are going to learn a lot from what it is that you have to offer. So, you're going to have to definitely share with us your pearls of wisdom and your nuggets for the position that you hold as a pre-medical board member, which is a position actually that I held at one point in time in the SNMA. And you'll have to share your story with us and just kind of, let's make this really fun and informative for the both of us and for our students. Now, if I'm looking down, I'm just making sure that, the stream is going on my cell phone. Okay, so I'm not ignoring you. I'm just making sure that we're still live and we're still going. Okay, so why don't you tell us a little bit about yourself and, a little bit of your story, and then after that we'll get into talking about SNMA and your position.
Absolutely. So I'm Todd Young. I am from New Haven, Connecticut. I currently live in Maryland, and it's been great. So I came back to the Maryland area for a job at the NIH. I was at the NIH for almost 4 years before transitioning into my new role at Georgetown. I'm currently director of research. I oversee the research efforts of the Designing the Futures initiative, which informally is called the Red House, and the Hub for Equity and Innovation in Higher Education. I guess my story, there's so many ways I can take this. I mean,
we all have a story.
I know. So we're on a pre-med webinar. So I guess I'll take it that direction.
Yeah.
I've honestly have always wanted to be a doctor. I know that's really cliche. Everyone's like, since I was 5, but honestly, since I could remember, that's the only thing I've ever wanted to be. I've toyed with the idea of being a teacher, but the only reason why I wanted to be a teacher was to be able to teach students about health and wellness. But I felt like even in being a teacher, I didn't have the clinical skills to really be able to teach them. So I was like, well, it's just not going to work out.
Right. Back to doctor.
Right. But you got to be the doctor, and then you can teach, and then you could just kind of make that full circle back around.
Right.
But other than that, I went to Georgetown for college. Before then, I went to James Ellis High School in New Haven, Connecticut. While I was there, went through a lot of experiences. I had the opportunity to become a emergency medical technician during that time. Mm-hmm. And during that time was really when it secured for me that I really wanted to not just be in the health profession, but to be a doctor. And I went on to Georgetown University. Kind of my connection back to the DMV area. I live in Maryland and back at Georgetown. I have my degree in sociology, and I have a certificate from the nursing school in population health.
Okay.
So no, I wasn't a science major. You don't have to be a science major to do what you want in life. And I chose not to be a science major because I became very interested in the phenomenon that was going on in the community. So I used to intern with an organization called Prevention Works DC. It no longer exists. But it was one of the first harm reduction organizations in the DC area. So harm reduction is essentially clean needle exchange. In addition to clean needle exchange for persons who use injection drug use, so the goal of doing harm reduction was to prevent bloodborne diseases, or any other diseases that may arise from using injection drugs. But we also did HIV/AIDS outreach or STI outreach. When we had the opportunity to secure food, we would get food, and we would do all of this from a mobile unit. So they had a physical location on Benning Road, but I was mostly in the mobile unit where we went into Ward 7 and Wards 8. And not only was I just kind of immersed in the work around, making sure that everyone had the services that they come in a mobile unit to use or to receive, but the conversations that we had.
Right.
During that time, the whole taxation without representation conversation was going on in D.C., along with the prevalence and incidence of HIV, particularly among Black women in D.C. at that time.
I know HIV has a very high HIV rate.
Yes, particularly in Black women, which I thought was very crazy at that time. So imagine the 17-year-old, 18-year-old out in the community talking to people, and not only talking to them, but they looked like my community. I grew up in housing projects in New Haven, Connecticut, and just it reminded me of home. So there was a comfort and a familiarity,
right?
And it was just a break from being on the hilltop, being in a space that was great. Loved Georgetown, love it to this day. I clearly came back full circle, but it was a break, but also I don't even know how to describe it really. It was a breath of fresh air, even though I was learning in so many ways. And what I wanted to know, I'm like, well, they're so smart. Like, there was this thing that I guess when I was home and living where I live, everyone was smart. Everyone knew their thing, whether they hustled hard or they just were just intellectually just genius, but they were dealing with some issues that I wanted to understand. So now we call it social determinants of health. I didn't know what that was. I just wanted to understand, okay, well, they're sick. They may have all these conditions and we have all these services, but they're not getting the services. So what's going on? Like, I don't understand what's going on. So instead of preparing to go into a post-baccalaureate program, after graduation or continue to do the research that I was doing, I actually transitioned from that position because the organization closed and I started to do breast cancer research, in Latina and African American women populations. I decided to apply to graduate school. And one of my friends who was at Columbia at the time said, you should consider the socio-medical sciences program. So I basically stalked Columbia. I love my program. It's socio-medical sciences is short for we call it SMS. That's the acronym. And it was exactly what I needed. Truly understanding the social factors that contribute to health outcomes, particularly in urban communities of color. That is what I wanted to know.
Right.
And I honestly believe that going through graduate school was what I needed to, in addition to being a EMT and working in the hospital and having the opportunity to work on the fire, the fire department as first responders. Going into public health made me realize how necessary it was that I continue my path into medicine. So I'm not there yet, as we know. I just mentioned that I work for Georgetown, but my journey is still ongoing, and hopefully sooner rather than later. I'm preparing to apply very, very soon. So I'm hoping that it all goes well the first time around. But if it doesn't, then I'm going to go back the second time around.
Do it again.
Yeah.
So we already have a question, actually. Lucy asks, where did you get your MPH and what made you want to do your MPH? And you kind of answered that a little bit. What is your work like? And she's asking that because she also wants to do an MPH. So
yeah, absolutely. So as I mentioned, I have my MPH from Columbia, so Columbia University Mailman School of Public Health, and I have my MPH in socio-medical sciences from the Department of Socio-Medical Sciences, and I have a certificate in social determinants of health. And it doesn't, I mean, it technically impacts the work that I do today, but it definitely impact the work that I continue to do in the community. So the different opportunities that I had to do research and still have to do research. I have been helping out a team around sustainable payment models for community health workers. I've been helping on the data side, but also informing the work that the team is working on. I took a little break so I can prepare for medical school, but I'm still involved in those efforts. In the fall, I had the opportunity to go abroad to South Africa to work on tuberculosis stigma research with an incredible organization. And because of the work that I kind of built up over my time in undergrad and in graduate school, doing research, working for organizations, particularly the New England Regional Health Equity Council as program coordinator. That was an incredible opportunity for me to get to know stakeholders in the fields of public health, particularly in New England. So all 6 New England states. And then having, getting those connections, having the opportunity to take on the opportunities that they recommended for me. But also when they're like, hey, Tatcha, are you interested in helping us with this? I just jumped on so that I can continue to just build skills. Most of the skill set that I learned was out of pure interest and pure curiosity. Right. So being curious about, what's going on in public health, even if I didn't want to be a dentist, I had, understanding, how critical your oral health is to, overall
health. That's right. Right. People don't realize that. Yeah.
Right. Understanding environmental health. I had an opportunity to work with a person who's in environmental health. Transportation, understanding how transportation is connected to all of this, just out of pure curiosity.
All your social determinants of health, basically where you live, where you eat, where you play, where you work. So
all of those things were not only interesting to me out of curiosity, but it's just my personal lived experience. Having gone through those things, growing up, and also, having family members who are dealing with the same issues around, food insecurity, lack of transportation, wanting to work but not being able to work, all of these different things and how it impacts their overall mental health, whether it's with depression or stress or obesity or not, just because of food insecurities and all these different aspects of it. Just
absolutely
lived experience and curiosity just made me want to know more about it and gain skills on how to do research. But ultimately, I want to be able to take all of this knowledge into clinical practice.
Right. And so that's another question that actually that Lucy has kind of asked as well. First, I want to say, hey, Dr. Renee and Dr. Ashana, you guys are on here as well. Thank you for joining. So Lucy had asked the question. She's asking, how did I make it through medical school? Which we'll get to in a second, because we're going to talk a little bit more about being pre-med, having a support system, and what it means to have a national support system. But she's asking also, she wants to be involved in public health, particularly international health. And so, if you know anything about me and my story, my story evolves from being a non-traditional student to, going to med school, going to residency, and eventually actually doing medical missions. And I'm actually going on a medical mission next month, or in September, actually. I'll be going on a medical mission. Typically, I go on medical missions in Ghana with an amazing organization called the International Healthcare Volunteers. And I've gone now maybe 4 or 5 times. Had to take a little bit of break to have a baby. But we're back at it again. And so we'll be joining the mission again this year. So, Lucy's question is kind of how do you combine all of those things? And the reality is that it is something that is very intuitive if you want to do it. You will automatically figure out how to combine that once you get to the point where, you are practicing or even in residency. So I would say that anyone who is interested in public health, if you're a pre-med and you're interested in public health, but you're also interested in medicine, focus on the medicine, obviously, focus on getting into medical school, and then it will happen. It will happen. You will find those opportunities because you will seek them out, and they are there. They're not hidden in any way.
There.
Right.
And you never know that they're there. For me, I just happened to run into a friend from graduate school at the American Public Health Association conference. And she's like, why are you here? I'm like, why are you here? We were both presenting on research that was public health, and she was in the middle of a fellowship at CDC. So, we were literally in a very casual conversation, and I said, without thinking, I'm like, well, I think I'm the only one in our cohort who hadn't done any public health work abroad. She was like, well, do you want to? I'm like, yeah. She was like, okay, well, send me your CV. I sent her my CV that day. She forwarded it to her former supervisor in South Africa. He contacted me within 2 to 3 days.
There you go.
We had a Skype conversation. and he welcomed me to come and assist with the research. It was that easy. And I didn't realize, I didn't realize it was that easy, but I'm also happy that, I have the support that I was able to take that months and go and do the work, even though I wanted to stay for 6 months to a year,
right?
But I have that kind of capital and, that kind of support to be able to do that. But, it was a matter of me just opening my mouth, talking to people who are doing
and just networking.
It really was networking.
Yeah. It's all about networking.
Institutional, but it just worked out. So my advice, as you mentioned, it's out there. The opportunities are out there. You just have to ask. Either you can find an organization to go with, so that you can assist with public health or clinical work via medical mission trips, or just talk to people who who are doing public health work abroad and ask them, hey, do you know of any opportunities? Are there internships? How about the organization you're working with? Do you need help? Do you think your organization needs help? And you never know. They might just call you and you just go and you learn so much when you're there. So just don't be afraid to ask or talk about it. I
mean, this is a very nice segue into kind of the topic of our conversation, which is, how to get a national pre-med support group or support system.
Absolutely.
And as we know, Tachelle, you are the pre-medical board member of the Student National Medical Association. Tell us a little bit about the process of you becoming pre-med board member, and tell us kind of, what your initiatives are, what you hope to achieve this year.
Absolutely. So, my journey to becoming a pre-medical board member, I can go into the technical process. But for me, the role came into my purview when I was in college. So when I was a freshman, one of my personal mentors, who was also on the board of SNMA, I'm pretty sure a couple of years before we even met, she said, when you get to Georgetown, find an SNMA chapter. Mm-hmm. I'm like, what is that? So she told me about the Student National Medical Association, how she thought Georgetown had a chapter at the medical school. She knew for a fact George Washington had a chapter.
Yes, absolutely. So the chapters are all over the place.
Right, they're all over the place in so many medical schools. So she told me to find a chapter. So I think being at Georgetown for a month and I hadn't contacted no one, she contacted them for me. She's like, okay, so they're having their regional medical education conference and you need to go. Okay. So she literally contacted the chapter president at George Washington to figure out a way to come and get me and take me to this medical education conference, in the region, that's how I got immersed into SNMA itself from the regional level. So, the DC, Maryland, Virginia area is Region 6 of the Student National Medical Association. Mm-hmm. And at that time, I had also joined MAPS chapter as freshman representative, but I didn't really know that they were connected until I went to the.
So let me just clarify. Let me clarify. So for those of you who may not know, so the Student National Medical Association, or SNMA, you will probably hear me talk about it a lot because it's an organization that I hold very dear to my heart. I'm very, very, very involved in SNMA, even as a pre-med student, medical student, and even now as a physician. But the Student National Medical Association is the largest minority medical student organization in the nation. And it basically houses, again, potentially close to 6,000 minority medical students, or at least 6,000 members. They're not necessarily all minorities, but they're 6,000 members. And they also have a chapter, or a subdivision, I should say, of the organization that is called MAPS, which is the Minority Association of Pre-Medical Students. And so that's the undergraduate division, if you will, of the Student National Medical Association. So many of you do have MAPS chapters at your colleges. You may or may not even be aware of that, but that is something that you should look into to see whether or not you have a MAPS chapter at your college, and it basically serves as the undergraduate division, again, the pre-medical arm of the Student National Medical Association. So, and as I mentioned before, I was at one point in Todd Shell's position as a pre-medical board member when I was a third-year medical student. And so, that's my story. So I'm going to continue talking because Todd Shell has lost a little bit of her connection. So if she joins us, if she joins back, we can resume. But essentially, if the Student National Medical Association is something that you are interested in joining, you can do so at www.snma.org. And I'll actually type that out for you guys so that you can see it. But again, the Student National Medical Association is the largest minority medical association that there is in the nation. So let me type out that URL for you again. Okay. And here it is, snma.org. Okay. So, the membership, so Lucy is asking how much is the membership. So the membership, I can't remember now. The membership has changed since I was a student. But if you go to the website, it should tell you what the membership is. Okay, here we are. Lucy's joining us again. No worries. I didn't skip a beat. I didn't even skip a beat.
Perfect.
So I see you joined us on your phone. Perfect. You haven't skipped a beat either. It's all about improv.
Yep, gotta improv.
You gotta improv. So it's all about improv. But yeah, so what I did was while I was waiting for you to connect back, I gave out the URL for SNMA, and someone had a question about how much the dues are, and I'm not familiar with how much the dues are at this point because they're certainly not the same as they were when I was a student, which was umpteen years ago.
$35. So it's $35 for 2 years to become an SNMA associate member. So if you're a pre-med student, you'll become an SNMA associate member, and I believe that it's $35 over 2 years.
Okay, $35 over 2 years.
Yes, I believe so, and I can confirm that.
That sounds about right.
And I encourage students to become SNMA associate members, especially if, one, you receive the benefits that we are able to secure for pre-medical students, whether it's around MCAT review courses or any information that's funneled through us, a scholarship. If we come up with other platforms that are within regions that we are overseeing from a national level, you have access to those. Also, we have pre-medical scholarships. We have MAPS Member of the Year.
Right.
And for those who don't necessarily have a MAPS chapter, so MAPS, I'm not sure if you explain what the acronym stands for, but Minority Association of Pre-Med Students. Some organizations or institutions rather can vary. I've heard of Charles Drew Society, or at Georgetown we changed the pre-med to pre-health so that it can be all encompassing, but it's still carried out the objectives of just a typical MAP chapter to serve not just pre-meds, which they did very, very, very well, but also just pre-health, those who want to go into nursing, those who want to go into dental, vet, want to be a vet, etc. So if you don't have a MAP chapter at your school, I would encourage you to become a member, because all you need is 2 SNMA associate members, so dues paying members, to create a MAP chapter. And if you have any questions about that, you can email me directly at premedical@snma.org, or you can email my vice chairs at MAPS, so MAPS @snma.org as well.
Okay, and I will type that out. So premedical@snma.org. So I will add that. Okay, so you guys can see that. Awesome. So So what made you want to be pre-medical board member of the SNMA? Because, obviously I had my own reasons for wanting to be pre-medical board member. I just thought being pre-med was fascinating, especially as a non-traditional pre-med. I just really thought like, wow, I've accumulated this wealth of knowledge. My experience with being being a non-traditional pre-med, certainly I think, was something that I felt like I wanted to share with people. And I just found myself, and at the time, we're kind of in different places, obviously, because I was in medical school and you're still technically pre-med. But I found myself in a situation where people were constantly coming to me and asking me questions, about being pre-med and asking, hey, can you do a mock interview for me? Can you do, can you look over my personal statement? And I was like, huh. So, it just kind of started to come naturally to me. So what was kind of your calling, if you will?
The wonderful thing is that the sentiment is essentially very, very much the same.
Right.
Having seen just kind of been in SNMA for 10 years, observing, just the MAPS efforts from the chapter level, and then becoming a regional MAPS liaison, before that, a pre-medical representative when I was in New York and becoming a regional MAPS liaison, understanding the MAPS or pre-medical efforts from the regional level, and then I wanted to learn more about the organization as a whole. So that's where it really started, understanding how is it an organization that's been lasting this long, predominantly ran by students, medical students. It still blows my mind that the organization it's still running for so long. We're upon our 55th anniversary. And it's run by medical students, and they have so much knowledge to give. They have so much just like love, really. SMA is truly a family, and I experienced that while on, at the chapter level when I was an undergrad, on the regional level, and I wanted to learn more about SNMA on a national level. And the way that I was able to do that, I joined the National MAPS Committee. So I wasn't pre-medical member yet. Last year, and I also became a FLP fellow. So the Future Leadership Project.
The Future Leadership Project.
I became an FLP fellow, which essentially was, it's not the very breeding ground for SNMA leaders, but for me, it made me more knowledgeable about the systems and structure of SNMA, but it also showed me how rewarding it could be as a leader and how much I had to offer and could offer to students who are not just in my situation that, similar to you as non-traditional, essentially not going into medical school directly after college, but having life experience, in a different health sector, but it's very much so connected to where we want to go, and knowing about, applying the medical school process, understanding, about aspects of the MCAT. I can't tell you what it's like to apply to medical school because I haven't done it yet. But over the years, I've had the opportunity to be in spaces where I've been taught these skills. And if I'm taught these skills, I can't just keep them to myself.
Absolutely.
I can't just keep all this knowledge and all these skills to myself. I need to be able to share this. So serving under our past pre-medical board member, Amanivier, who's now our national president-elect, she really showed me the way to be able to serve effectively, to be genuine, to be human. It gets busy. It is not an easy role because we lead a committee of not just 40 people, but we also serve all of the pre-meds around the nation. It's not an easy feat. So making sure that we have the support that's needed from our headquarters and also from our national board of directors, but also from our own committee, making sure that we are bringing other people into, our efforts to make this happen. We can't I can't do pre-med stuff by myself.
By yourself, right.
I can't do it by myself.
Right.
I took, it was a challenge really for me. I took on the challenge of running for this position. Not that I was confident that I would assume the role, but I also realized that, okay, well, initially, I was running against someone and we both had great ideas, and I'm like, well, we can do this together. We both have, our journeys on our way to medical school, and we both can actually do this role together. But, I ran for the position. I was very firm on what I wanted to do, in terms of my goals for the upcoming year. And I can go over that very shortly. But also understanding SNMA nationally, understanding its mission, understanding the strategic goals of the organization. Being an FLP fellow, I had a great opportunity to do a project that was very integral to the continuation of SNMA from a fiscal standpoint. And I'm like, oh my gosh, like this was an incredible project, and I want to be able to not just leave this project for someone else to do, but I want to keep going with this project. I want to get involved on the national level as a national leader, so I can help with, with the contents of my project, but also put it in the context of being pre-med, and to serve pre-meds. So, it's an accumulation of things. I think, when I started talking about at the very beginning of the question was, my journey into SNMA, but also seeing leaders that look like me. When I went to AMEC for the first time, my first AMEC was in Indianapolis, and it was incredible. It was incredible to see all the leaders on the stage at the banquet, and to hear from our pre-medical board member about, the initiatives that, that he was working on, and how it all just kind of funneled down to me. It funneled down to me, and I'm sure everyone else has their individual, their AMEC story or journey, but I'm like, I felt this. This is not just for me, but I shared this experience with so many other people in the room. Right. It's incredible.
Right. You walk into this space that perhaps you've never you've never walked into before. I mean, that was my experience. Mine was, in Atlanta. And, you walk into this space and you're just like, man, like, I could do this. Like, you feel like all of a sudden there's a force that is propelling you to actually achieve your goals, right? And that's why I named this particular interview How to Get a National Pre-Med Support Group, because you literally walk into the national conference. And for those of you who have never been to an SNMA conference, I'm telling you, when you walk into the conference, something happens to you.
Something happens.
Something good happens to you.
It's like, I don't even know how to describe it. Like, I'm like, this is incredible. Like,
it's tingly.
Inspired. Like, you're literally instantly inspired and motivated to do more. You're motivated to be a pre-med. One of the efforts that I had the opportunity to do when I was MAPS chapter president is I wanted to put a face to medicine, not just for myself, but to the other students who were in my class, like my student class, but also all the other pre-meds at Georgetown. And I wanted to make sure that they realized that medicine is beyond just this organic chemistry book. It's beyond just this biology book or being in lab. Medicine is truly about seeing the people who's doing it, people who will be doing it, and then figuring out, okay, how can I get there too? Yeah. Because, the books, yes, you have to do it. You have to do well in your classes. That's important. But I needed to feel like I belonged in this field. I needed to feel like I was around people or peers who were able to support me when I get into the field. Correct. And without SNMA, I feel like I don't know if, I'm pretty sure I would still want to be a doctor nonetheless, but I was able to grasp onto people who are now lifelong friends in this process. I have friends who graduated from medical school already, who were MAPS with me, who joined SNMA when they got to their medical school. But it's like, and also just with doctors like yourself, you all are at the conferences, you're walking around, you're talking to us. One of the doctors who's very involved, took me to the side and just asked me a question. It was a very random question. I'm pretty sure I was looking like where I need to be, what workshop I need to go to right now. And then we started talking, about my journey. And this was the first year that I brought in my brother to take care of him, and it just turned into a crying session. And it was like, oh my God.
I needed to get this off my chest.
Right. I was like, I don't even know where this came from. But it was also comforting. I think I needed that cry, one, but it was also comforting to realize that there are people out there who support me. They may not know me personally. They may not have known me all my life, but understanding the journey that I'm on, they were once there before.
Right.
And all they want to do is help me get there.
Yeah. And they want you to get there. They literally, like, I can say, now on the physician side, I want all of you to get there because you want to get there. Right. That's what you want for yourself, and that's what I want for you. And DeSena says that the conferences are amazing, so she's been. And I also want to say hi to Dr. Centrell. Dr. Centrell is watching as well. But yeah, I mean, that really is part of, getting that national pre-med support group or support system, which you kind of mentioned when, once you get into medical school, then you join the medical student portion as, the SNMA. And then you have like this national support system as a medical student, and it's absolutely amazing, and if you're pre-med right now, you may not understand what that means. That's why I say you have to go to the conferences, either a regional conference, definitely the national conference. But if you don't understand what that means, what it means is, I won't liken it to a sorority or a fraternity because I'm not in a sorority, so I can't say for sure.
But it's different.
Yeah.
Understand what
but it certainly is something where it's so widespread that, I remember being a third year medical student and I was doing a rotation in Ohio. And I didn't know anybody in Ohio. I was not from Ohio, but I wanted to do this rotation in Ohio. And, we worked it out where I called a friend who was in SNMA at another school, and he called a friend who was at SNMA yet at another school, and I ended up staying with her.
Look at that.
Yeah. And I have to tell you, when I was a medical student at my school and pre-meds would come to do their interviews, they would come and stay with me or my husband. At the time we weren't married, but they'd stay with him. And so there is that just big network, like when I was pre-med, when I did my interview at my school, I actually stayed with one of the medical students who, who was part of SNMA, all because we were SNMA related in some way. Yep. So, that's the network. That is really how you gain a national support system.
Absolutely. It's incredible. And even now, like I'm, full disclosure, I'm still trying to get through organic chemistry. And there's a MD PhD student who, we're both on a national committee. And he's like, yeah, I tutor organic chemistry. He's like, just call me.
Right.
And we were just at our National Leadership Institute in Minneapolis and we were talking. He's like, yeah, just call me. I'm happy to,
to assist you. Yeah.
I'll send you some questions. We can talk about it. He's like, because you need to get into medical school. That's really the goal.
That's right.
Help us get through the door.
Yeah.
We have to get through that door. And sometimes for some of us, it takes a lot to do it. But
correct.
If you want it, you do it. You figure out a way to get it done. And I'm just very grateful that, like you said, I have this network of incredible students and even now incredible doctors, who are truly rooting me on along this journey, and I am so grateful. And a part of it is, even though I'm still on my journey, like all the other pre-meds across the nation are, I want to be able to help instill that, instill the motivation and also the inspiration to keep on going. It is not easy.
It's not easy.
This situation. And, I know I'm on, the older end of the average, of medical students who will be entering, but nobody's journey is the same.
Correct.
We're all in this together. We're all trying to get there. All we can do is truly support each other. If one know of one resource, share it. You know, if one knows of another entity that can help you get something done along money, share it. I'm all about sharing the wealth. I can't just keep this all to myself.
Yeah,
you know,
exactly.
Share it all. And the great thing is that now I have this platform where I can do that. I can do that. Not that, you know, I couldn't have not been pre-medical board member and do the same thing, but now I have.
But now you have,
support to be able to get all this information out and to secure these benefits and, you know, be on webinars such as this one to talk about, you know, what it means to be a part of SNMA. It is truly a family. Like, it is truly an incredible, this opportunity to be a part of. And it just happens naturally. You just go, you talk to people, even if you're shy. I've met several shy pre-meds, even shy medical students.
Right. Somebody will seek you out.
Right. Right, exactly. But they're like, yeah, you know, I keep on coming because this is where I get my inspiration from. I get my inspiration from sitting next to somebody in the workshop and I can't find my pen and they give it to me and now we're in this deep conversation about how we have to take our step 2 next
week.
You know, it's
very organic.
It's just organic.
No pun intended.
Right. Oh my But truly, it's like, it really is a family. And I'm not just, you know, on the platform marketing a MEC or marketing.
Absolutely. Yeah.
But it's more so a true encouragement to go, to get the resources, to talk to people, to do the mock interviews, to do the personal statement review, to talk it out with somebody. Sometimes,
right. Because nobody can do this alone.
Right. No one
can do it alone. And
just your school advising. Some have great advising officers. Some don't. But at least if you're in this space where there are so many people who are going through the same thing or have already gone through it, you can ask them.
Right.
They can provide a perspective, some guidance, and it's worth it. It's worth it doesn't even cost very much to go to the regional conferences.
Absolutely. I mean, I think, you know, I think at some point, you know, there's the question of cost but it is an investment, and anything that you are going to invest in, you want to just make sure, obviously, you're going to get some return. Right. But what's very important, just like anything else, just like with college is an investment, but it's an investment that you have to actually be invested in.
Right. Absolutely.
Right? Your pocket can't just be invested. You actually have to be invested. And it's such a great opportunity to network with people, to meet people, to get a mentor, and really just be out there. Like, if it's something that you're going to do, if you're going to be a part of any national organization, whether it's SNMA or any other national organization, you want to be able to invest in yourself, not just monetarily, but, you know, you have to get yourself out there.
Have to.
Yeah. Desena says, I met you in San Francisco. This is April. Oh, she met me in San Francisco. Okay. And she said, big up. She said, hey, Todd Shell, Region 6 pre-med rep in the house.
Yes. She is now Region 6 pre-medical representative.
Region 6. I'm actually Region 2, so.
Yeah, well, it's okay. It's still love.
Biggest region in SNMA. Yeah. At least in the number of states.
It is definitely massive. Definitely massive.
Yeah.
Literally, even with Desena, it was a conversation.
Right.
Pretty was at a workshop and she came up to me and we started talking. She was mentioning, you know, she's no longer an undergrad, but she wanted to be involved. We talked. She came to the regional meeting. We talked some more. Gave her my contact information. I said, I really think that you should consider regional leadership.
Yeah.
And she did. And look at her now.
There it is.
It is incredible. You know, you gotta seek the resource. You know, if you want to be a leader, you know, in an organization that's not only helping you, but you're helping others, ask.
Yeah.
Oh, there's
exactly. Exactly. Well, you know, I get a lot of questions from pre-meds. You know, how do I secure a research position? How do I get a leadership position? How do I do this? How do I do that? And I'm like, you know, I can certainly answer some of these questions for you, but the people who are in the throes of doing these things oftentimes are your peers.
Right.
You know, they're your peers, or they're your immediate, you know, they're immediately like one phase removed from you. Absolutely. And so I can certainly answer some of those questions for you, but you could probably save yourself a lot of headache, a lot of angst by literally just talking to someone who is your peer.
100% agree.
Yeah. Who is your peer. So Lucy says, I wish everyone had that mentality. Many pre-meds are mean and wouldn't be in med school. She wouldn't be in med school till she's 33. And she says, I think it is about time. I think it is about to find the right network and support system. Yeah, absolutely. I mean, you know, you do. You have to find people with the same mentality.
You know, I'll be in my 30s when I get into medical school too.
Mm-hmm.
So, you know, it's really, it's a lot of, I mean, I have been in situations where there were mean pre-meds. Right. I'm not gonna lie.
Right. I think we all have.
We all have, but some people are just wired to 100% competitiveness.
Right.
Like, this is mine. I don't care if you get it. This is for me. This is for me. Yeah, it could be for you, but that doesn't mean that we can't study together. It doesn't mean that we can't share the same books or the same resources. We're both trying to get there. You know, even if we both create the curve together, that is great. You know, but at the end of the day, they're not the only pre-med out here. So, you know, becoming a part of SNMA, I promise you, it is a great opportunity for you to be around thousands of students, pre-med, and, you know, to be able to find that person who you can call and, you know, encourage them. My vice chair of administration, who's now on the National MAPS committee with me, she took her MCAT Tuesday, and she's a person of faith like I am. So I called her Monday night and I prayed with her. You know, you're gonna do this MCAT and you're gonna do this MCAT well. You know, find people who you can hold on to, and you know, you support each other. That's really what this journey is about. I'm pretty sure you may have colleagues now who are physicians who went through the same process, and because you went through it together, you kind of understand how they work. They're not going nowhere. They're always going to be in your life at this point.
Absolutely.
You know, so you got to get out there and find people who, you know, who aren't mean, who are not just, you know, in this for themselves. Yeah, you got to be pre-med by yourself. You're getting evaluated on your own merit, right? But at the end of the day, that doesn't mean that there can't be somebody alongside of you who's helping you with the journey.
Correct. Yeah, because none of us can do this alone. And I've seen people try to do it alone. It's very difficult, oftentimes unsuccessful. And it really is just a stress that you don't have to put on yourself when you have other people who have similar stories to you, who are willing to help you. You know, certainly that was my experience, at least in my post-bac years, that I met some wonderful, wonderful people. And that's actually when I got exposed to SNMA. I didn't know about SNMA when I was in undergrad. I actually learned about SNMA when I was a post-bac student, and eventually actually became the chapter president of my MAPS chapter. And then shortly after getting, you know, into medical school, 3 short years later, became the pre-medical board member. But it was definitely something that I look back on now and I say, wow, like SNMA really helps me to kind of believe in myself that this is something that I can do. And, you know, there's a saying that you can't do what you can't see, right? There's, that's
exactly how I felt. That's exactly how I felt when I was an undergrad. I can't be a doctor if I'm not seeing people who are doctors. If I'm not seeing medical students who are in medical school, how do I expect to be a medical student if I don't see that? Like, and that's really what I wanted to show people. I wanted to show people there are people who are actually doing this.
Absolutely.
You know?
Absolutely.
And there's so many of them, and you can do it too.
Yeah. And I can't tell you how many students, med students, pre-med students, I can't tell you how many of them contact me per week.
Yeah. Yeah, that's
you know, partly because of SNMA, but also partly because of what I do. But today I think I got like 2 messages from, you know, SNMA specifically related, you know, students who contacted me. Hey, I need your advice on this, that, and the other. I'm trying to be an OBGYN. I'm trying to get into residency. And this is just the life. This is the SNMA life. This is what you do. And you become part of this network. And I just can't emphasize enough to all of you who are watching that it's so important. You can get a national network. Don't necessarily rely just on the person next to you. Right. Because that person who might be your best support system, might live 3 states away.
Yeah.
They just might. And you might actually meet them at a national conference, a regional conference. It really is just an amazing organization. And so I'm really excited to see, all the things that you're going to bring to, the pre-med arm of the organization.
I'm excited too. It's not easy. There's so much to be done. But I do it all out of love, and I do it joyfully. And I'm just very grateful to be in this position to be able to do this work.
Yeah.
So I'm great. Thank you all who voted for me, who voted me.
Right, because the pre-med's going to vote, huh?
Right. They do get a vote for the principal board member.
Yeah.
The medical students as well. So I'm grateful that you all trust me with these efforts, and I promise that I will do the best that I can to get whatever we need to get done. Right. Honestly.
Yeah.
So, and I'm grateful. I'm definitely grateful for you, Dr. Darko, for staying involved, remaining incredible, liaison and an incredible resource as a past pre-medical board member, so, there's this line of people who now I can go back to if I have any questions, and I'm happy that you're one of them. So thank you so much.
Oh, thank you. Thank you. It's my pleasure, my absolute pleasure. I absolutely love SNMA, and, it's like, it's just an amazing organization. I just love what it does, for students. I love what it's done for me. And I just love what it continues to do. So tell us again how we can get in contact with you, how we can, if you're a pre-med, what are some ways that you can be involved in SNMA, either on your local, or regional or national level?
Yeah. So definitely on the local level, I'll definitely say you can start with your university. If you don't know if there's a MAPS chapter, inquire, go to your Center for Student Programs, or an office that support, potentially the minority groups on campus. Ask around, see if there is a pre-med, organization for the minority students, and they actually might have a MAPS charter. So even if they're not called MAPS, they might still be MAPS. And if they're not, it might be, a great opportunity for you to gain some leadership and to make them a MAPS chapter, which I think would be incredible. Also on the regional level, there's other pipeline or additional pipeline work, via ACE Prep, and YSEP. So there are initiatives that are going on in, middle schools, and high schools that many of the SNMA chapters at the medical schools are involved in. And I'm pretty sure there are opportunities for you to get involved if you want to help out those students as well. The regional leadership institutes, if you want to become a leader, not just only in SNMA, but a leader in general. This is a great opportunity for you to go and learn about the resources, to get the leadership training, to talk to doctors and medical students, about just leadership in general. And what else? I'm pretty sure there's just so much. I know in Region 6 last year, we had meetups. We had MAPS meetups where the pre-medical students who are in the chapters at the undergraduate, universities in the different states, so DC, Maryland, Virginia, that was an opportunity for the pre-meds to come, and, whether you were walking across the National Mall together or eating lunch together or just having a place to go to meet other students who are doing the same thing they're doing, that was awesome. On the national level, for the National MAPS Committee, right now the executive board positions are filled, but it doesn't mean that when we're planning for our national conference, this is an opportunity for you to help with conference planning. This is also an anniversary year for MAPS, anniversary for MAPS, so this will be a great year to come in and get some leadership skills on how to plan a conference. Also, there's always an opportunity to share your ideas. If you want to be involved in a very specific way, just email me. As I mentioned, premedical@snma.org. Email me. I really want to do this in my region. I really want to do this at my university. Do you know anyone, or can you help me do this? That's what I'm here for. Email me. I'll make sure, if I can't do it personally, I'll make sure to put you in contact with your regional leaders. And I'm pretty sure they will help. If they can't, then we'll reach out to another region and we'll make sure it happens. I promise you, make sure it happens. So those are some ways I will 100% encourage, if you can make it to the National Leadership Institute. It is a scaled up version from the Regional Leadership Institutes. In our annual medical education conference, it is literally the convening of all 10 regions across the nation for you to come, and just the workshops are incredible. Like, oh my gosh, the exhibition hall in itself has just about every single medical school that you might be thinking about going to. This is a great opportunity for you to come out and get those resources, get to know those deans of admissions who are there, get to know the students. So if you have any specific questions, you can ask them there, but also to get on their sign-up list. Oftentimes that is a entry. That is a good way to show them that you're truly interested in going to their medical school. As Dr. Darko mentioned, you have to invest in yourself. And by coming to conferences such as the Annual Medical Education Conference, this is investing in yourself. And those medical schools understand that. They know that it can take a lot to get there. So definitely come out. But like I mentioned before, if you ever have any questions, concerns about being pre-med, you're trying to get there, but you don't really know how, or, you're in a situation like myself where it's not the direct route to medical school, but you're determined to get there, I'm still a resource for that too. So please contact me and I'll do the best that I can to connect you with other resources, or just, to talk to you myself. I'm always available. So thank you so much.
Yeah, great. Thank you so much for that, Tacho. Well, I definitely appreciate your time. Again, I appreciate all that you're doing in your position. I'm excited, to see the culmination of all of your work at the national conference. The national conference is going to be in Philadelphia. It is every single Easter weekend, starting that Wednesday, going all the way to that Saturday night. Usually Sunday morning is usually the board meeting. But if you don't know, if you're always asking yourself, when is the SNMA conference? Just ask yourself, when is Easter?
Basically, all of my Easters since, a long time ago, have been at SNMA conferences. But it's always been great. It's always in a different city. You get to tour medical schools. You get to see all these different places. I've traveled to most of the different states in this country because I had to go for AMEC. So
Same here. That's when I started traveling, was because of SNMA. I started traveling all over the country, going to conferences and meetings, and I really started to travel because of SNMA, and it's just been wonderful.
Absolutely.
Very wonderful. So, awesome. Thank you so much.
You're welcome.
And you have a wonderful rest of the day. I will stay on for any questions, if anyone has any questions. But thank you so much, Tacho. And I look forward to talking with you real soon.
Yes, me too.
All right. Take care.
Bye, everybody.
All right, everyone. So here it is again, snma.org. I hope you enjoyed this information. You are welcome, Lucy. You are very welcome for all the information and the advice. I talk about networking a lot. I think it's extremely important for pre-meds in particular to network. You're welcome, April. It's important for pre-meds to network. It's important because it's something that you're going to be having to do for your career pretty much all throughout. And so why not start now? Don't feel shy. Don't feel like, well, I'm not at the point where, I want to be. So, I can't. It's like, well, that's what networking is for, right? Networking is to get you from point A to point B. Thank you, Dr. Roshana. Thank you so much. It's to get you from point A to point B. It is to get you to the point where you actually want to be. So don't think that you have to come with all your cards laid out on the table, that you have to come with, with everything just done. That doesn't work. The way that people come with everything done is because they've networked. They've gotten a mentor. They, have joined an organization. They've gotten information. They've gotten resources. They know exactly how to do that because they're surrounding themselves with people who can help them to do that. And that's what that's what we all need to do. So if you are pre-med and you're kind of sitting home trying to think about how you're going to become a doctor and you haven't reached out to anybody, you haven't talked to anybody, you haven't joined an organization, you need to look into doing that. You need to look into doing that sooner rather than later. Because networking is just that important. It is just that important. So I will leave you with that. I hope you guys are having a really, really great day, great summer. I certainly am. And I hope to see you guys on the next one. This is going to be available on YouTube. I'll put it up on YouTube. And it'll be something that you all can just kind of watch over and over again if you need to, get some nuggets of information. I think Todd Shell really shared with us, just from her journey, with the National Institute of Health. She mentioned the NIH in case you didn't know what that acronym meant. The NIH, she talked about research. She's definitely someone, many of you contact me asking about research. Todd Shell is somebody you should be contacting if you're thinking about research. She can either put you in contact with, someone that she's working directly with, or she can put you in contact with someone who's, several people removed from her. But she's someone that I would definitely reach out to. So again, hope you guys are having a great day, a great summer, and I will leave you on that note. Take care, and I will see you on the next interview. Bye.